And welcome back, everyone. A health alert for us women tonight. Doctors say our lives have gotten so busy, it's actually endangering our health. I believe it. In tonight's Family 411 report, Sheila Gray reports on why women are skipping out on some very important medical exams. Sheila.
Women of childbearing age can be pretty religious about going to the doctor, but once that time of life is behind them, some get lax about their health care, and physicians are concerned.
Because I tried the vitamin route, before I turned to asking my doctor.
When Amanda Miller started having symptoms of menopause, she went to the health food store instead of her doctor.
And it just wasn't doing anything.
Now Amanda's getting relief after seeing her physician.
A little bit goes a long way.
OB-GYN Dr. Scott Bembry says about half of the patients he sees for menopause symptoms have skipped preventive exams and screenings before.
Pap smears, mammograms, especially the screening colonoscopy. That you may miss a disease process, to a point that it's later and harder to treat.
Women's health experts say it's actually pretty common for women at midlife to skip seeing their doctors. They're often still raising kids while taking care of aging relatives, holding down jobs, and leading busy social lives.
Do you worry about missing something?
Yes.
Kathy Smith is one of those women.
I was the caretaker for my parents. That took a lot of time, and I started a new business. And, it was just like, I just didn't want to go to the doctor one more time.
Her friends Debbie Bulger and Gayle Farmer don't skip the doctor, but admit they're surprised at times by how their health at midlife has changed.
I don't want to admit that I'm getting older, but
they think they're going through menopause. And that's a complete misnomer. You don't go through it like you're passing through a town.
Dr. Holly Thacker of the Cleveland Clinic says women beginning the second half of their lives need more than just mammograms and pap smears. Doctors also need to check their weight, blood pressure, cholesterol, thyroid, vitamin D, and bone density. And midlife is a good time for women to evaluate their medical providers.
Women should seek out a healthcare provider who is interested in menopause and midlife women's health.
I think that's something I need to do.
Kathy and Debbie are looking now, and Gayle recently found a new doctor.
I'm not shy, so I don't mind asking him the questions.
They agree, while they do have more questions about their health.
And I've got this muffin top.
Yay!
Where is that coming from?
They're making the most of this time in their lives.
I'm pretty happy. I'll be 60 in August, but that's okay. I can live with that.
You got to make the best of whatever it is.
That's right. Doctors say midlife and menopause are the perfect time to improve health habits, get up to date on screenings and exams, and work with healthcare providers to chart the second half of your adulthood. And if you do decide to look for a new provider who specializes in midlife and menopause, be sure to ask how much of her practice is made up of women in this age group.